Giving prescribed medication to help ease symptoms is an important part of home hospice care. Medications come in many forms depending on your loved one's needs. Measuring medication in a medicine cup should be done at eye level. Place your thumb at the level that you want to pour the medication to. Medication droppers should also be brought to eye level. Medication can be crushed and mixed in something soft like applesauce or pudding. This is helpful if your loved one has trouble swallowing. Medications that reduce pain and anxiety can be made in concentrated forms. These types of medicines allow for your loved one to have to swallow very little amounts of medicine and still get relief. There are many different ways medicines can be given. Patches, lollipops, and suppositories are all options you can discuss with your hospice team. Fentanyl patches can be very helpful in alleviating symptoms of pain and even shortness of breath. Be careful when applying the patch. If your loved one develops fevers or is sweating frequently, contact your hospice team. Patches do not work well in these conditions. There are many different sites to choose from when applying a fentanyl patch. If your loved one has lost a lot of weight, use the areas of their body that have the most fat. If your loved one has a PEG or percutaneous endoscopic gastrostomy tube, you can give medications this way. Make sure you ask your hospice team if each medication is safe to go through the PEG tube. Some medications that are long-acting should not be crushed. Dissolve medications in a medication cup. Flush the tube with sterile water, usually 30 ml is enough. Pour the medication into the large syringe while it is connected to the tube, and then replace the plunger. Flush the tube again, usually 30 ml is enough. You need to apply some pressure, but you should not feel like you are forcing the water or the medication. If it does not flush easily, contact your hospice team. These tubes become clogged easily. Contact your hospice team if you think that the medications you are giving your loved one are not helping their symptoms. It is easy to become nervous when your loved one is in pain or having unpleasant symptoms. Remember to stay calm, read the name of the medication and the directions before giving the medication. It is helpful to keep a log of what medicine you gave and when. Giving pain medication before the pain becomes too severe is the best way to avoid a pain crisis.